Hello, I'm Dr. Jonathan C. Trent, and I'm a medical oncologist in the Department of Sarcoma Medical Oncology at the University of Texas MD Anderson Cancer Center. This year at ASCO, we presented a poster called the reGISTry, and this is a study looking at imatinib use in the community and in the academic center from a large patient population in a retrospective fashion, although the data were collected prospectively. This study consisted of 1,053 patients that were entered since November 2004. We identified 208 patients that received adjuvant imatinib from this population. What we found was that 181 of these patients received imatinib 400 milligrams per day as their initial dose. We also found that 17.3% of these patients had dose changes due to progression. The median treatment duration was 366 days. With that median duration of treatment, one can see that half of the patients received adjuvant imatinib therapy for more than 1 year, while half of the patients received adjuvant imatinib therapy for 1 year or less. Now, when physicians are assessing risk for recurrence in patients with primary GIST, the key factors that are typically used are the site of the primary tumor, the size of the primary tumor, and the mitotic rate that the pathologist describes within the primary tumor. Mitotic rate is a known risk factor in GI stromal tumor, perhaps the strongest risk factor, and is also a surrogate for proliferative activity or tumor growth rate. Surprisingly, our data revealed that only about 1/3 of patients had a known mitotic rate when the decision was made to institute adjuvant imatinib therapy, in many cases for several years of therapy. So what we found was that this reGISTry provided a very meaningful tool to evaluate patient care trends over time. We found that adjuvant therapy prior to the year 2007 was very rare, but after abstract presentation of the ASCO Z9001 data, adjuvant therapy for patients with primary GIST was adopted robustly across academic and community settings. We additionally found that 87% of patients that were treated with primary GIST received imatinib at a dose of 400 milligrams per day for more than 1 year. Interestingly, in our study, the duration of therapy did not correlate with known risk factors such as tumor size, tumor site, or mitotic rate. So one of the key takeaway messages of this study is that mitotic rate are identified in only about 1/3 of patients with metastatic GIST. This is counterintuitive in terms of mitotic rate being one of the most predictive factors for recurrence for patients with primary GIST. It's clear that additional publications and education is needed in both academic and community settings in order to promote the acquisition of mitotic rates and its use in risk stratification in determining whether or not to prescribe adjuvant therapy for patients with primary GIST. Thank you.